Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement.
I'm your host, Lee Dill, and I am joined today with Vinay Patel of Proactive MD, and we're talking about a new product offering of Proactive MD's called Proactive RX. And what this is doing is taking virtual pharmacists to collaborate with the clinic staff for better quality care for their patients. Vinay, thank you so much for joining me today.
It's an honor to be here on the Granite List podcast with you. Thank you so much.
Absolutely. So tell me a little bit about your history and how you have been working with Proactive MD to create Proactive RX.
So great question. We've been working, myself and our team have been working with Proactive MD for the past year and a half now, or just over a year actually, in understanding that Proactive MD and their advanced primary care model help support hundreds of thousands of employee lives across the country through their primary care clinics. You know, the one issue that employers keep raising is pharmacy costs. What can we do about pharmacy costs? What can we do to help address that, mitigate it? How can we optimize our pharmacy spend? And there were just questions coming around pharmacy. And so they invited our team to come and strategize, brainstorm around some pharmacy ideas. And what we came up with is much different than what we started with. And it's really cool that what came out and became Proactive RX to help support these advanced primary care clinics with pharmacy services, pharmacy consults, requests for customizing pharmacy programs for employer groups, and really embedding a virtual pharmacist on site with these clinics to, really, as you mentioned, enhance quality of care for patients and provide drug cost savings to the employers.
And just as a little bit of a level setting too, you don't provide the on-site pharmacy. Most of your clinics don't have an on-site pharmacy. So you're bringing a service that was not able to be provided in the past, correct?
That's right. It's really unique in the sense that when people think about pharmacy and when they think about pharmacy with an on-site clinic, they're thinking, oh, you're going to be having a dispensing pharmacy to give meds out to everyone. And it's completely different than any of that. In fact, what we're doing doesn't have its own neat little box in the benefits world. We're doing what the clinic does for their patients, for the employees of that employer, in that they're providing a medical service, medical consults to the patients to help diagnose conditions and provide treatment, help better care for the chronic conditions that are in that employer group. And we're coming alongside and collaborating with that care team, enhancing it with pharmacy services. So those are pharmacy consults, pharmacy education on drug education, or optimization of therapy or chronic care management to help support the clinicians that are already providing the great care that they do to these patients, to help make it better quality of care for the patients. And then we also have some savings programs that we can offer to help the employer lower their drug spend on these brand and specialty medications and help patients access them at no cost.
That's great. So how do you identify members who might be able to benefit from these virtual pharmacy services?
So we have a pharmacist virtually present in the clinics on site for those employers that have an on-site clinic or shared clinic site. And we first start by identifying the highest risk or high cost members. And there's usually somewhere between 5 and 12% of members that are contributing to 80+% of the cost of the health plan. And so we target on those and we identify those members and we say, okay, what medications are these members taking? What conditions do they have? How can we collaborate by inviting these members into the clinic so that we can consult with them after they've completed their onboarding and establishing care with the clinician. And so we have consultations with the member. We identify, here's some drugs that you're taking that we can help find a better source for this. And the nice part is that all of this happens outside of the health plan. The members can use their health plan for all their common medications that they need at the pharmacy. And then once the plan approves a high cost or brand medication, it hits on our list, on our data feed that we get from the employers. And then we reach out to the members and we tell them, we see that you're on a high cost medication. We can source that drug for you, for the employer outside of the health plan, and help you manage your chronic condition better through remote patient monitoring and the services that we offer in collaboration with the clinic staff and the providers.
Okay, so that's a little bit different than where I was originally thinking this worked. Is I go in and I'm prescribed a new medication, and now I've got this virtual pharmacist that I can consult with. You're doing more proactive outreach and identifying these members that might not have been to the clinic yet and bringing them in for an on-site.
And to your point, both ways. If a patient has a question, concern, they just saw a doctor and the doctor wants to pull us into a visit that says, hey, it looks like we got a pharmacy issue here. Can you help us with figuring out why this prior authorization is getting rejected, or why the member can't access this medication, or the cost is just too much, or they have a question or an issue or a drug interaction that I'm worried about that we'd like you to help with. So the members and the providers can pull us into consults, or we can reach out, as you mentioned, proactively to get members engaged with the clinic if they're not already, and tell them about the services we offer and how we can help them.
So you mentioned a couple chronic conditions that members might not have come to the clinic before, and you're using pharmacy data and claims data to identify these members. What are some of the conditions that your clinic can help treat based on this data?
So the most common chronic conditions that we know exist all over the country, cardiovascular conditions like high blood pressure, diabetes, cholesterol issues, then heart failure, drugs that have chronic symptoms like arthritis, rheumatoid arthritis, and specialty conditions where the patient may not even be seeing the primary care doctor for these conditions, that oftentimes use an autoimmune drug for psoriasis and other autoimmune conditions where you'd probably see a rheumatologist for. We can actually loop into that care as well, collaborate with the specialist doctor that's in the community, and then also with the member, and tell them how we can help optimize their care by promoting or advocating for biosimilar medications or generic medications when they're available as well, to help, again, the plan save money and the member access these drugs for much lower costs.
Right. I'd be curious to know how many of these members are actually establishing a PCP that they never had because they've always gone to these specialists just by this outreach communication.
Great point. Yeah. I mean, we know that primary care is hard to access and there's not enough people using primary care. And so this would really help improve that engagement.
Mm-hmm. Okay. You talked a little bit about the type of services that are available or how people might qualify, but what types of different pharmacy services are you able to source and utilize to benefit the plan spend or the employees' dollars? Can you elaborate on that?
Absolutely. So we have a variety of different programs, all outside of the existing health plan, to help members access these programs. One really cool program that we've developed exclusively for Proactive MD is called Proactive Advantage. And Proactive Advantage is a cost plus 340B program, which we can explain to help get into the details, but essentially that provides employers access to specialized drug pricing where members get access to the drug at no cost and employers get significant savings. And it's a collaboration with community health centers and health systems in their area to really help lower these drug costs. And that's one of these programs. The other programs that we have include international sourcing of drugs for those employers that feel comfortable and want to access these drugs internationally. And then we also have a generic and biosimilar program. So one of the key enhanced services that we can provide to these clinics is an expert with drugs, and that's a pharmacist, and we call them a pharmacy advocate that's present virtually at these clinics. They're licensed pharmacists that can help evaluate drug treatments and drug regimens that patients are taking and say, hey, did you know that, it looks like the drug company released this brand name medication and what they did was they just changed the dosage a little bit, but we can actually get you on the generic and it really just clinically there won't be any difference. And we can have conversations like that with clinicians and then also talk about biosimilar medications, that there's these alternatives to these specialty medicines that are out there that are biologics that have these equivalents that are much, much lower costs and equally as effective.
So when an employer brings you on, is there, a range of services or opportunities that you can provide, or do they pick? How does it work? You listed so many different opportunities for savings.
Here's the fascinating part of this. And just like Proactive MD in their advanced primary care model have a value-based care model of financing their services. So essentially, it's a fixed cost monthly model so that everyone can utilize as much primary care as they want. It's outside or not tied to what we have today, which is fee for service, where the more services you use, the more it costs the system, the more it costs the employers. This is all fixed fee and bundled. And so that's exactly how we structured and execute on the pharmacy services side as well. So the key piece here is that just like there's a fixed monthly cost model for advanced primary care services, there's a fixed monthly cost model for the pharmacy services, and it includes everything. It's all just bundled together. You have a pharmacy advocate that's present, and they're your pharmacy navigator to help access all the programs, all the services that we have, as much as you need to utilize this pharmacy resource that's available to that clinic for all the members and the clinicians and the employers and all the questions and concerns and customization that they need and new programs that we could develop. That's what they're there for. And the extra sort of part that we added on to this is those services are 100% guaranteed. So that means if we don't save you as much as it costs to have the pharmacist there for the year, we will refund the difference to the employer so that it's a net zero cost service for the employer to add this onto their clinic. And it'll also ensure that there's savings associated with the new service and higher quality of care for the members through data that we report out on these chronic conditions, so on and so forth.
Well, that sounds like a no-brainer. I can fix my medical and my pharmacy costs for my employees if I get 100% utilization, especially.
Exactly.
That sounds like magic.
And then you have this resource there that's trying to find all the ways that we can optimize the savings for the employer and also savings for the member. And, we sort of true up that at the end of the year to find out, okay, this is what it costs to have the pharmacist there, and this is how much we saved you. Here's the data. And we're going to structure all of this so that we can report that out and employers can understand it.
It sounds like you're guaranteeing at least a 1-to-1 ROI.
That's correct.
Do you have any data to share to show what average savings typically are?
So we've done several pharmacy analysis for groups with Proactive MD. And across the board, what we've seen is typically when you add a pharmacist onto an employer's plan and through the Proactive MD clinics, there's about 15 to 25% savings off of the total pharmacy spend. So that's all the programs, all the savings that we could squeeze out of a plan through things that we're seeing that we can help optimize the health plan. 15 to 25% is what we've seen typically in total pharmacy savings. That's with the pharmacists.
Yeah, that's incredible. So we talked about savings, but how do we make sure that the patients are provided the most high quality, cost-effective care? What kind of measures are you putting in place there?
That has to do with all of the reporting. So we need to make sure that it's crystal clear to the employer that this new service not only will help increase the quality of care through the care team integration and collaboration we'll have, but we'll be able to show through chronic care measures like A1C reductions and cholesterol control and blood pressure control as some of these common key metrics that we use for chronic conditions to show that the quality of care is better when you add a pharmacist onto the care team. And then we also have some soft data that we'll collect with the patients reporting, did you find benefit in the services you've had with consults in the pharmacist and the services that were offered in the clinic in general and outreach that the pharmacist has done to members. So we'll collect that survey data. And then, of course, finally, we'll have crystal clear reporting on here's how much you spent through the plan for your drug. Here's how much we got the drug sourced for a lower cost. And here's the delta on there. And so then everyone will have just this dashboard to showcase, okay, here's why the services are efficient because the pharmacist is a fixed cost and here's where the savings are. And let's look at the comparison.
Yeah, that's great. Do you offer Proactive RX for just Proactive MD clinics, or are you offering this to other standalone clinics?
So we are working with consultants that work with the Proactive MD family, and we also have services that we can offer outside of Proactive MD, but it requires a conversation to make sure that there's enough support for those employers and that, we honor the model that Proactive MD wants to offer to the nation's employers. So yes, we do. It just requires a conversation to figure out if it's the right fit.
Right. And I would imagine that y'all have got it pretty streamlined how your clinics work with these virtual pharmacists. And it's a very clean model, I would imagine, that ensures the best outcomes. So For groups that are interested in maybe starting an on-site clinic or bringing in that have an on-site clinic with Proactive MD and are interested in increasing their services, what is a best fit?
So we can take all sizes of employers. The size isn't really what the issue is. It's really looking at their drug mix and the mix of drugs that they're taking. If you have a plan that's really optimized, where they have, patients just on generic medications, there's not much for us to do except to add on the service. And if they were looking for convenience or access or cost of care, if they want other pharmacy strategies and sort of strategizing and brainstorming around that, we can definitely offer those services. The best fit really would be those folks that have an on-site clinic with Proactive MD today and are looking to find ways to address, tackle, and optimize their pharmacy spend. And that's really where we're starting, and we're scaling up really quickly to provide these pharmacy services where Proactive MD is today.
Great. And if someone wants to get in touch to learn more, where should we tell them to go?
We have a great website that the Proactive MD team has created for the Proactive RX product. You can go to the website proactive-md.com/proactive-RX, and you'll get to see all the services that we offer and reach out to the Proactive MD team to learn more.
Okay. Well, Vinay, thank you so much for joining me today. And thanks to our listeners for another episode of the Granite List Live.
Thank you so much. It's been a wonderful conversation.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.